our September Board of Health meeting to order. Present, we have board members Frank Ehrlich, Joan McNeil, Janet Karpiak, and Norman Weinberger. We also have Health Department staff members Aniela Fignon, Kelly Tomlinson, and Brian Weeks. So good morning, everyone. The first item on our agenda is the approval of the June 25th, 2024 meeting minutes. And I just want to, before we do that, I just want to say we had a meeting in August, but we didn't have a quorum. So we had notes that were taken, but it wasn't an official meeting. So I don't believe we have to approve them, which is why we have to approve the June meeting minutes now. So do I have a motion for that approval?
So moved.
Okay, I think Frank and Norman. So we'll be 1 and 2. Well, that'll be the second too. Any discussion or comments, edits about the meeting minutes? All right, hearing none, I'll call for a vote. All those in favor say aye.
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 Any abstentions? Any nays?
No.
All right, the minutes passed. Thank you, everybody. Next, we have Kelly Tomlinson here with our health educator. She is going to be giving a presentation about a suicide prevention grant that we've received and all the great progress that the team has made over the past year. September is Suicide Prevention Awareness Month, so we thought this would be a great time for her to come and present on the activities of the grant and all the initiatives that they've been leading. So I'm going to pass it to Kelly. Welcome. Good morning. Thanks for being on to present to us.
Good morning. Thank you so much. Let me share my screen quickly. Are you guys seeing the slides or the presenter view?
We see the slides.
Okay, good. So as Deanna was saying, thank you so much for having me today. September is Suicide Prevention Awareness Month. And so we wanted to raise awareness of this important topic. And it is also 1 full year since the Norwalk Health Department received their grant for suicide prevention work. And so we wanted to highlight all of the accomplishments that we did this year. So just a very brief overview on what the grant asks us to do. So CDC's Division of Injury Prevention had awarded the state's public health department with funding to take a public health approach to suicide prevention, intervention, and response. The state then looked at the different health departments throughout the state and identified Norwalk as a high-risk area based on our suicide rates from 2015 to 2019, and then approached the health department to see if we wanted to take part in this grant opportunity. The ultimate goal of the grant is to bring together partners from a variety of sectors to identify, assess, implement, and evaluate suicide prevention initiatives that are taking place in Norwalk. The idea being that suicide has no single determining cause, and preventing suicide really will require the cooperation, involvement, and strategies from multiple levels, multiple sectors, collaboration, and communication among different partner agencies. And so the grant is really asking us to convene and help bring these kind of think tanks together to see how we can best work together to address suicide prevention here in Norwalk. Just quickly to go over some of the deliverables that the grant was asking us to identify. So there was some participation with partners, committees, and advisory boards, creating and updating a local suicide inventory about the resources and services that are taking place here, looking at creating suicide prevention and post-prevention plans, surveilling some data, so around suicide prevention, suicide attempts, and suicide deaths by suicide, and then involvement in suicide prevention, intervention, and response, or SPIR initiatives, as well as communication and spreading some messages around resources that are available. And so our year 1 accomplishments, it has been a busy year. So we wanted to highlight all the work that we were able to do. And so around participation on committees and advisory boards. So in addition to taking part in our statewide and regional suicide advisory boards, the health department brought together organizations from all over Norwalk to meet and discuss what suicide prevention looks like here locally. More specifically, what is being done, what gaps we're seeing that need to be addressed, who our most vulnerable populations or citizens are, what does that tell us, what's the data telling us, as well as who else do we need to bring to this table, who else needs to be involved in this conversation. We're extremely grateful and have wonderful partners that joined in right from the start to help us address this work. In terms of city departments, we had representatives from the Community Services Division, the fire and police departments, the public schools, housing authority, and the senior center. We had clinical teams represented to share what was happening on the treatment end. And so we had Norwalk Hospital, the federally qualified health centers with Community Health Centers Incorporated and Norwalk Community Health Center. We had AmeriCares as well as EMS. And then lastly, we had a ton of prevention partners and community-based organizations. We had Positive Directions in Norwalk Partnership, Norwalk Acts, the Hub, which is our regional behavioral health action organization. We had representatives from veteran organizations such as the VA and VFW, Open Doors in Mid-Fairfield, Family and Children's Agency, Ripple, Triangle Community Center, Human Services Council, Catholic Charities, as well as Rowan Center, Kids in Crisis, and some faith-based organizations. So we tried to represent as many sectors as possible where people could have touch points for suicide prevention. Next up was looking at our inventory and gaps analysis. And so the grant asked that we create, update, and utilize a suicide prevention resources inventory. The grant did give us an opportunity to partner with UConn Health to send out a pre-made survey, as well as looking to help us with the gaps analysis. And so we were able to provide that service, but Norwalk Health Department took it one step further and did a really in-depth inventory as well, alongside with our partners, to really look at what current programs, policies, services, and resources for suicide prevention, intervention, and response that we had. We looked at what age groups were being offered, if there was a fee involved, what hours they were open. We really tried to look at as much as we could. And we also went a step further and looked at the additional services that we have in Norwalk that address those risk and protective factors for suicide prevention. We used all of this inventory to then identify gaps and areas for improvement. A couple of examples that we found for current programs are that we have support groups, treatment, therapy, crisis lines and warm lines, trainings, events, work groups, and policies all taking place already here in Norwalk. In terms of risk and protective factors, we found that we had food access resources. We have signage around explaining that there is hope and where to go for help. Economic support such as job skills training, rental assistance. We have safe storage initiatives, reducing substance misuse, and working with high-risk populations to share those services. Some of the gaps that we identified were in need of trainers that speak different languages to make sure we help all of our residents. Unsure funding security for treatment programs, and then groups that should be trained further. So those that have touch points with youth to help identify warning signs, as well as seniors or those in the LGBTQ populations. So next up was our postvention planning. So this was one of the bigger deliverables we took on this year. So studies have found that an estimated 115 to 135 people are directly impacted by one death by suicide, with 1 in 5 reporting a devastating impact or major life disruption. Postvention plans provide a framework for providing a coordinated response in the event of a death by suicide or other tragic unexpected death to help minimize possible contagion or clustering of suicides. This is the first documented plan that was here in Norwalk. Not being said this work was still being done, it just wasn't documented and provided that framework that everyone can then use one streamlined approach. And so the Norwalk Postvention team, we have referred it here as a crisis response team, really aims to support the healing of individuals impacted by loss, as well as communities, by assessing the needs of those impacted, providing support and connection to services and resources, and is comprised of a large group of people directly involved. And so there's the police department's behavioral health unit, Norwalk Hospital, the city of Norwalk, public schools, community services, Positive Directions, Mid-Fairfield, and Family and Children's Agency. This is kind of the core team, and will bring on additional supports as needed or identified by the family that they're supporting. The idea that having a strong postvention plan in place can ultimately prevent future suicides from taking place and is really a prevention tool. So moving right along, the next piece we have is a data surveillance requirement by the state. And so we have ongoing data analysis and surveillance from a variety of resources to really help us understand the trends and patterns that are taking place around suicide and how we can prevent them from moving forward, or seeing what age groups are impacted. So Brian from our team does a really great report where he looks at the epicenter surveillance system of ER data and gets really comprehensive data around who is attending the ER based on mental health in general, who's going in for suicide attempts and who's going in for suicide ideation or suicide thoughts. And so Brian does an incredible job. Thank you so much for, keeping that going. And that's up to, he can get it up to the day. So we really utilize his data using Epicenter. And then we also lean on the state's Connecticut Violent Death Reporting System, some of the CDC's risk factor and behavioral surveillance systems. Norwalk Acts and Positive Directions has their youth survey data that they go into the high schools and ask the students, or middle schools and ask the students directly some thoughts. We receive some data from there. The Norwalk Community Health Assessments. Yale University gave us some data around geriatric suicide risk that we could see that senior population's perspective, as well as the Data Haven Wellbeing Survey. And then going out into the community to do that suicide prevention, intervention, and response initiatives and outreach and activities. And so just to name a few of what we got to do this year. So we had the Norwalk for Mental Health Day. We were able to work with Norwalk Partnership to get the day titled as a check-in day. So Jordan Porco Foundation offers kind of a template on the best best practices for doing a mental health fair. So which resources they would recommend, how to get people involved, and how to really promote that mental health piece. And so we were able to help the event this year become a check-in day. And so we were able to be on the planning committee for it, and we got to participate in the actual day, which was great. So next up, we had placed Gizmo's Possum Guide to Mental Health, which is a children's book that reviews kind of how to cope with hard feelings for children in a fun way by working with Gizmo the dog as he encounters a different, hard feelings and how he works through those. And so we placed those in the pediatric waiting room of Norwalk Community Health Center in both English and Spanish for families to read while they waited for doctor's appointments. The next goal is to get that also placed at Community Health Center and AmeriCares in year 2, as well as seeing how the schools can incorporate this curriculum. Next, we invited our healthcare partners to attend a presentation from Hartford Healthcare and the Department of Mental Health and Addiction Services to learn how they can implement the zero suicide approach to suicide prevention. And how, so this framework is comprised of 7 different elements based on best practices from when people enter the hospital to leave. Where are all those touch points that people can put in suicide prevention practices? And so we were able to introduce that to the health care providers, and year 2 is really seeing how can we actually work with them to get that implemented. We were able to hold some workshops and trainings around suicide prevention and how people can recognize the warning signs for suicide, help have that intervention, ask the question of, if someone is thinking of dying by suicide, and then getting them the help that they need and inspiring hope. And so we were able to host and organize an ASSIST training, which is applied suicide intervention skills training. We were able to train 22 local behavioral healthcare providers on this training to help kind of enhance their ability to, when they're working with their clients, to recognize the warning signs and help make a plan for safety. In addition, we were able to go out into the community and do QPR trainings, which is question, persuade, refer. It is a community helper training or a gatekeeper training for the general public, which again, very similar, helps identify warning signs, ask the question, have that conversation, and help people get help before it's too late. We went to a variety of places. We wanted to make sure we did touch upon those vulnerable populations that we identified. And over the year, we were able to train 211 people, including the whole Norwalk Fire Department, Triangle Community Center, Norwalk Public School students, youth serving providers, as well as our ERT volunteers. In talking with the risk and protective factors, we did talk about the idea of reducing access to lethal means for those that are suffering with suicidal thoughts. And so some of the initiatives that we took in helping reduce access to lethal means is creating a postcard that really highlights the medication drop box here at the Norwalk Police Department. It is a safe, free, and anonymous way to get rid of any unused or unwanted medications so that it's not sitting in the home. In addition, we ordered doTERRA bags to give out to community residents. That is a safe way to deactivate medication and throw out safely at home for those that you're not using, as well as providing lock bags for people who are still using that medication but need to store it in a safer way. The last thing that we recently did was myself and the Director of Behavioral Health from Family and Children's Agency recently became trainers on CALM, which is Counseling on Access to Lethal Means. There's also a general public training that we also did called Conversations on Access to Lethal Means. And that is having that conversation with both counselors and the general public for those that are suffering with thoughts of suicide. How can we make them safer now? So how can we work with them to create a safety plan by removing those access points to lethal means such as firearms or medications? And then all year long, we got to attend outreach events to really share the materials and messages regarding suicide prevention, resources available, and items to help with mental health support. And then we took part in national campaigns around suicide prevention. So you can see on those slides to the left-hand side, those for the past 2 Septembers, we have partnered with the Hub to have billboards put up at our train stations, providing the messages of hope, sharing 988, which is the National Crisis, Suicide and Crisis Lifeline, really promoting that resource for those at train stations and commuting. I attend a ton of outreach, events as much as we can. We went to a Screenagers event at Ponus Middle School, diversity and career fairs. We went to Pride in the Park, veterans health fairs. We're really trying to get out as much as possible to share these resources as far and wide as we can. We participated in Drug Take Back Day. We created a website that's kind of a landing page for resources if people are looking for things to, for help or places to go. And then we printed 988 wallet cards in English and Spanish so people can take that with them and have them, if they come across anyone that is suffering and needs to share some resources. And I'll open it up to any questions. Thank you. Option.
Thank you so much, Kelly, for that incredible presentation. Does anybody have any questions for Kelly?
Okay.
Report. Thank you, Kelly.
Norman, were you talking to us? I don't know. I heard you.
I was just thanking Kelly. I thought it was a great report.
Thank you.
Thank you. Joan?
Kelly said, excellent report. I saw you guys up by the college, and it was well received by the students. The nursing students was talking about it afterwards.
Oh, that's good.
I think, yeah. So yeah, very, very impressive.
Thank you.
Thanks, Joan. Thanks, Norman.
Mm-hmm.
Thank you, Kelly. That was a really great presentation. A lot of great information. You and the team are doing incredible work for the community. So thank you.
Thank you guys for letting me present.
Mm-hmm.
Next on the agenda, we have an update on strategic plan implementation. So I'm going to pull up my slides. Can you see the slide, or is it in presentation mode?
No, that's good.
You're good? Okay. All right. So as you all know, we have our strategic plan. It was passed in early 2023. I think the last time we, formally revised it was in March of 2023. And so we wanted to give an update on where we are with implementation. Just as a review, our strategic priorities, we wanted to focus on workforce development, community awareness and trust, impactful programs and services, foundational infrastructure improvements, and technology. and other priorities that we embedded throughout all the different goal areas and our health equity and climate change. As a refresher, these are our goal statements that are all focused around the different priority areas. So continue to build and support a diverse, happy, and skilled workforce, strengthen community awareness and trust of the health department, provide impactful programs and services that support community needs, strengthen systems, processes, plans, and policies to assure a high-performing health department, and effectively use and enhance technology to optimize the delivery of public health services at the health department. So we went from our priorities to goal statements to creating a comprehensive implementation plan. So staff developed this and worked with board members, and they include overall, it has 5 goal statements, it has 20 objectives, and there are 60 different strategies and actions listed throughout the plan. And all of these actions and strategies have deliverables, measures. It lists who's responsible and the staff to implement, and it has timeframes for implementation. The plan itself spans 2 calendar years. So it goes from January 1, 2023 to December 2024. So staff looked at all, we have a spreadsheet where we're looking at different activities for all the different, objectives and the strategies. And we've come up with different measurements for how we're doing in all the different areas. So there are a few areas where we haven't really been able to start the work yet. There are a few areas that are below target, sort of like on pause, not where we had planned on being with those activities. There are 19 that are in progress. It means we're working on it. We're actively pursuing and completing those activities. On target for 21 of those different areas, and this means like we are where we need to be, where we want to be in those areas. And 14 of the strategies and activities have been completed. We also looked at it by the different goal areas. So goal 1 is workforce development. So you'll see we have several of them which are on target and in progress. We have one that wasn't started and one that was below target. Goal 2 is community awareness and trust. Goal 3, again, is impactful programs and services. Goal 4 is foundational infrastructure improvements, and goal 5 is technology. So you can see these different goal areas, they're not balanced in terms of like where all the different strategies and activities. You can see there's 20 different ones just within in foundational infrastructure improvement goal. So next, I'm just going to highlight some of the progress within the different areas. So there's been a lot of activity in workforce development. Aniela has led the team in updating our workforce development plan, and we're almost finalized. We just have to finalize the training schedule, which again is very comprehensive. So we're actually trying to look at scaling it back a little bit, or just scaling it, make sure we're putting it over a 5-year time frame so we really balance it out. But that workforce development plan is very near completion. We've been implementing the workforce development plan as we've been updating it. We have a folder where we save and store information with training materials and sign-in sheets, using a Excel spreadsheet to track the number of trainings that are offered and who's attending them, staff attendance. We've also looked to do these individual professional plans for staff. So what that is, we have these trainings that are kind of standard for the department, but where are each individual staff members? They're given the opportunity to go through a tool with Aniela, our project coordinator, to figure out, and with their supervisor, what are they interested in? Where do they want to be? How do they want to grow? And so this is an opportunity for staff. We've had a couple of staff members complete it, and we had a few others that have expressed interest in this voluntary opportunity. We've done a lot with recruitment and looking to make sure we have a qualified and diverse workforce. We've taken a look at different job descriptions that we've reposted or created new ones to make sure that they're written in a way that are inclusive and that we can get qualified people and also broaden the pool of folks that are applying for these jobs. So really looking at, what are the backgrounds that are necessary, educational work backgrounds, what is necessary, what can be learned on the job. We've also looked at one of the areas that we're below target is we're working with our city's diversity, equity, and inclusion officer. That position is vacant as of right now, so we're hoping if that's filled, we're able to work with that person in the future. But getting a real expert's opinion on what our recruitment and hiring efforts. We've had some discussions with Health Equity Solutions and one of our partner organizations on things that we're doing. So that's something that we've been working on. We also have been collaborating with many different academic institutions and community groups to support recruitment for specific positions. So Lamont Daniels, our Chief of Community Services, he has his calls with community partners. And so our staff members often share when we have position vacancies to help get the word out. We also send postings to our academic partners who assist us with sharing the job. And we also have executed 3 affiliation agreements with different academic institutions, and we're hoping to do more as we can to host interns. We've lectured at different courses and academic programs to talk about public health and talk more specifically about local public health. And as you know, we talked about onboarding and orientation policies at a recent meeting. We have completed an onboarding toolkit that has several different checklists and resources for new employees. Staff have created an internship policy. We have different orientation presentations developed. Aniela did one specifically for the Office of the Director that it's been completed. And so, a lot of effort has been put into the onboarding with new great tools. One of the things that we wanted to focus on was we had several new staff members that have been onboarded during the pandemic, and so they didn't get all the comprehensive trainings that one would normally get during that time. So there's been a real concerted effort to go back and figure out, all right, who needs access to quality improvement training and who needs to complete their preparedness training. So we're catching up to all of that. And then the one area that in this where we haven't really started yet is there was an action to develop a job guide template for specific Norwalk Health Department positions to assist with onboarding. So really the focus has been on the more general onboarding, things that can apply to everyone. And in the future, we hope to get more specific by completing some with, more specific positions. So that can help us with succession planning. And then supportive work environment, there's, again, a lot of attention to this. We have a supportive work environment policy that's in progress. We completed a comprehensive assessment of our work environment. We've established a supportive work action group that has included over 14 staff members that are actively participated in wanting to build and support a better work environment for all of us. And we've also been able to secure funding and a grant to if we want to work with a consultant on this work too, to build out that policy. And we have some employee recognition programs. We have some that SWAG, Supportive Work Action Group, that's their title, have been looking to find ways we can further recognize employees' accomplishments. We have a monthly staff newsletter that highlights accomplishments and updates, and also really promotes the EAP, the Employee Assistance Program, to make sure staff are constantly reminded of the different resources that are available to them as an employee of the health department. And staff also share great health and wellness tips. And then the last kind of piece of this is climate and health equity training. There's also the Public Health Win Survey that we are participated in the past, and we're going to be participating in it again as well to help us provide good data on where we are with our work environment. And climate change and health equity, we've had a health equity training that was offered to staff at an all-staff meeting. Several staff members have participated in Climate for Health Ambassador training and completed it. And we've done Narcan and CPR training. So we've done a lot with different training. The next area that we've been implementing is around community awareness and trust. One part of this is making sure that we have a process and budget in place for consistent translation of communication materials into Spanish and Haitian Creole in order to provide equitable access to information. So we've Our staff has a really consistent process for Spanish translation, working on improvements as well for Haitian Creole. The area here that we're really trying to figure out is the budget for this, right? So we have a lot of staff members who are multilingual, who can support this. We also have technology tools in place that can help with assisting with translating. But we've looked to see for other assistance. And so we're trying to figure out, how do we make sure we build that into the budget in the future so that we can continue to do this, important translation work. Staff have been working on maintaining the website. They're also have been looking at making sure that all our different communication meets culturally and linguistically appropriate service standards. And so the Community Health Division has a standard operating procedure for this, where staff use a checklist to determine different improvements that are needed for communication. So they've done an excellent job with that. We continue to look for ways we can have more meaningful community engagement. We've done different surveys of our clients and the public for our different program and service areas. We're also trying to find ways that, we've been exploring things like community ambassadors, advisory committees, implementing different focus groups. And then the last part of this is visibility. So as you know, the staff have done a lot with social media, with press releases, different videos, campaign posts to raise awareness for different public health topics. And also, adding a YouTube channel to house videos, because as we know that videos are a really effective tool for communication. Sorry, last part for goal 2 is looking at partnerships. And as you just saw from Kelly's presentation alone, right, that's one program area, all the different partnerships that we have with our different community organizations. We also do this, within Norwalk and then at a regional and statewide level as well. So we've had examples where we've worked with Stanford Health Department to develop messaging around Mpox disease and vaccination. We work with our regional preparedness partners on different communication initiatives. We partner with Norwalk Library, our community services department fellow department on like highlighting different public health topics in their newsletter because they have a really great reach out into the community. We've also updated our own programs and services brochure. We've looked at the different in evaluation of programs and services, a lot of the focus here is within our clinical services and our preventable diseases division. We've looked at, our sexual health clinic, our travel clinic. We've, explored, billing revenue for our sexual health clinic. That's one area that we've identified that we need to do. We haven't been able to do that yet, but we did secure some grant funding to help us work with a consultant to look at potential additional sources of revenue in that area. We've looked at, how can we expand women's health services, looking at increased presence in the community and expansion of clinic hours, but really we would need additional staffing for some of these areas that we'd like to implement. But we have been looking at accessibility with our different availability, working with our different community partners, the state health department, the school-based health centers, urgent care centers, and others. We've looked at, again, how we can partner with those external partners. So Darlene and her team, they participate, and I think Brian as well, in the Connecticut Sexual Health Coalition. We've established different partnerships related to sexual health services for students. We've looked at, worked really closely with Fairfield AIDS Program and Circle Care Center. And we've also looked at very closely at school physicals and vaccinations, and worked with area providers and the public health school systems to meet the needs of the children. And we don't, one of the sort of the strategies was looking at formal agreements, written, to explore what is needed. And a lot of these partnerships have been informal. We haven't had formal written agreements, but we have had several different, I mentioned, affiliation agreements related to universities and students. And I said I was going to talk that long, but there's just so much, so many activities. But I'm just going to keep highlighting a few other things related to goal 3 is we have looked at the travel clinic program. We participated in the Strategic Scholars Program, which was a national program. We're able to work directly with consultants who help us talk through evaluating. We had several staff members who participated in that process and looked at the travel clinic to see, you know, where are areas, where should we be focused on. So a lot of the focus has been on that. And then I mentioned we'd like to do sort of the same thing for a sexual health clinic to see, you know, where are the opportunities for improvement there. Most of I think I said we have 20 different activity areas within foundational infrastructure improvements. So our project coordinator, Aniela, has led the review of the different reaccreditation standards and measures that we're going to need to abide by the next go around. We completed an annual report for our FAB this year that went really well. We've under Aniela's leadership, really reinvigorated the quality improvement work group, held 4 different meetings over the year, 1 each quarter, looked at proposals for quality improvement projects. There's been different trainings that have been available and given to quality improvement work group members. They've completed a quality improvement culture assessment, which was then used to update the quality improvement plan. And there are currently 2 QI projects that are actively being completed and almost at completion. Nora, the community health improvement area, it's our first community health improvement plan. Initially, we thought we would do a community health improvement plan sooner, but because the hospital is undergoing their next iteration of the community health assessment, which we're partnering with them on, we decided we're going to hold off on updating the NORA community health improvement plan until that community health assessment is completed. So that's one area where there hasn't been a lot of progress in, but we will be doing that in the future. Grants organization is one of the quality improvement projects. Is really looking at how we electronically file a lot of the grant information to make it more organized and streamlined, and so people can find information more quickly, and that's been a big success. As you all know, policies and plans, because you see all the different policies and procedures, there has been a lot of policies that have been reviewed over this past couple of years and been reviewed, and you've provided feedback on. Aniela has a whole spreadsheet where she tracks like where we are with the different policies, and the senior management team is responsible for, they know which policies they're responsible for, so they've really taken a big concerted effort to look at those policies and rewrite them with their staff and revise as appropriate. We're constantly updating all our different plans, like the quality improvement plan, the performance management system, workforce development. Aniela's worked with Glenn, our preparedness coordinator, on our emergency preparedness plans and creating materials to summarize all the different plans we have. And one of the things that we're looking to do next is to really document the emergency response team program operations and have a written guide for that program. And then peer learning and sharing, with that staff newsletter I mentioned, really trying to spread information about the different programs and services throughout the department. We have our quarterly staff meetings where we provide updates, and that's been great. For climate change, we've met with different city departments. We've worked, the redevelopment agency has been taking a leadership role in a lot of different projects related to climate and change. And so we've participated. We've done a lot, as you know, with like the heat study and looking at heat. We've looked at air quality, Brian put together air quality monitoring hub. And so we've also done different trainings that I mentioned. And I think this is also an area where we'd like to continue to see where are there more opportunities for us to be involved in. And then lastly, technology. As you know, Brian is the program director of epidemiology and informatics. And so we've really tried to see how we can sort of embed technology within the core infrastructure of the health department in the past, we've had several different staff members and obviously the IT department working on this, but we're trying to, do a more concerted effort of how can we continue to improve the use of technology, make our information more secure. So we've implemented different features, utilized new systems to improve security and confidential information. We will be working with a consultant to look at establishing ourselves as a HIPAA hybrid entity and looking at different improvements with HIPAA compliance. We've secured funding for this, and we've also received council authorization for this, so that's in the works. And then one of the big things that we've been working on for years is how we can update our financial systems to make improvements and to utilize more features on the city system to reduce redundancy. So we have been implementing new features in Munis, the system. We've met with the comptroller's office and finance to talk about different other potential opportunities to make different improvements. And so that's an area that also came out in the efficiency study from the city. So I'm happy that we've made really great progress there and looking forward to even more. We're working with the different city departments on improving our permit and licensing system. So we're working with a consultant on that. And we've been trying to, as we've mentioned in the past, convert more of our paper records to electronic formats. And the last piece of this is really making this information more publicly accessible. And as you know, Brian has talked about all the different hubs that he's created, data hubs, and his community health and well-being profile that he presented at the NACCHO conference about. And then utilizing different software tools to support surveys, track, document grant health activities, utilizing VOC, Smartsheet, different Microsoft platforms has been really helpful. So I know that's a lot of information, and I would like to see if you have any questions or thoughts, but one of the things I just wanted to bring to is about updated timeframe. So strategic plans typically are 3 to 5 years. We wanted to focus our plan, really the first 2 years, the work plan, but I'd like to update the plan and sort of extend it out more. Right now it ends December 2024, and I'd like to sort of take a look at the work plan again and update some of these timeframes and make some adjustments rather than go through a whole new strategic plan update where we look at different goals. I think we have a great plan. I like where we are. I think we have more work to do. I think, as always, we're very ambitious. So I'd just like to give ourselves more time. In the meantime, we're updating our community health assessment right now. We're going to have more data on community health. We'll be able to have our community health improvement plan. So I'm thinking once all of that is complete, then we can go through an updated process where we do the full, strategic plan update. But right now I'm hoping that we can just update this work plan and take a look at some of the time frames. So I'd love some of your thoughts on all of that. Frank?
Yeah, I thought it was excellent. The presentation, the plan seems to me to be on point. My only comment is if and when you make a similar presentation to a lay audience, you need to explain to them why all of those things are being done. They will never understand all the effort, for example, being put into employees and staff. They do understand why that affects their health. And those are the points you need to make, I think, if you're going to make a presentation to a lay audience. And unfortunately, the mayor's advisory groups are almost all lay people. So if you make a presentation, I would just suggest you emphasize the why more than just the what.
That's great feedback, Frank. Thank you. Yeah, I just sort of jumped in and just talked about all the technical stuff, but you're right. Like, I need to give that background and that explanation for the different audiences. So I really appreciate that feedback. Thank you. Does anybody else have any thoughts or feedback? Any questions?
Deanna, I think it was a great presentation, and I agree with extending the time frame. My question is, how far out would you go?
I was thinking at minimum a year, but I was thinking 2 years might be better. So like to give us more time. So ideally, I mean, I think 2 years would be good
Okay.
to extend it out, if
Okay.
that's okay with you all.
Yeah, no, that would be fine with me because it's pretty complete. So yeah.
I agree. It's an excellent presentation. You've always been ambitious, and and you're so thorough. So, definitely to be able to incorporate the newer information, that 2-year time frame is important.
Thanks, Janet.
Yeah, I agree with the 2 years simply because if you finish something in less than 2 years, all the more credit to you.
Thanks, Frank. All right, so we will make those adjustments. We'll take a look at it, and then we'll, of course, send you the updated plan for your rear review and any feedback. Thank you. All right, I realize I took up a lot of time. So Brian, I'm sorry, but I'm passing it on to you next for your epidemiology updates.
Thanks, Sienna. No worries. Hey everybody, I'll just keep it short and sweet. So we'll talk about three things. Our favorite thing, respiratory viruses, then mosquitoes, and then just the recent CDC HON related to Mpox. So let me just pull up my screen share. But it's a lot of kind of like what I presented on even last month in terms of a lot of the CDC HON, which covered pretty much the whole gamut. So let me just make sure the screen share is showing up correctly, which it is not. Hold on a second. Not sure why it's pulling up the right screen.
Brian, while you're doing that, I'd just like to mention Ken Lamine he was joining while I was presenting too. So our board member, Ken Lamine, joined. All right, back to you, Brian.
Yeah, no problem. All right. So, hey, everybody. So kind of, again, the standard presentation, what you're seeing is from the CDC, the Respiratory Illness Data Channel. From the last time that we saw this has been updated. So they actually kind of simplified it, which is kind of nice. So they have a community snapshot that kind of loads out straight to what's going on in the country. So overall respiratory virus activity in the United States is low, but then when you break down the wastewater viral activity levels, you can see how COVID's high, flu is minimal, and RSV is minimal. And then you could kind of hone in, zoom into Connecticut. You see Connecticut overall respiratory viral activity is minimal, but COVID's high, flu minimal, RSV minimal. But and then when you select Fairfield County, just keep in mind it still just keeps it in that state level in terms of activity. But at least it's just a nice way to kind of summarize things and just kind of maintain awareness. And so that's kind of kind of the CDC to kind of summarize it in said fashion. So there's that. Then we'll jump to the actual wastewater map, which again, they also have updated relative to the last time we've seen this together as a group. So now it's being presented by state. If you may recall, it was done by regions. So like the Northeast, the South, the West Coast, things of that nature, where it was a good indicator and an ability to monitor relative to COVID activity, as we were seeing the West Coast really kind of experience that initial summer uptick, and then it made its way to the South and the Midwest and the Northeast. So this is just a more granular way in terms of the geography to kind of see what's going on. So this is looking at it for COVID, the wastewater mapping. And as you can see here, for the Northeast, we are in very high activity. Fortunately for Connecticut, we're at high, but we're in that mix, so more or less. But then you also can see like the Pacific Northwest and certain parts of, the Mid-Atlantic, the South, Midwest are also experiencing that very high activity, and then also high activities just generally speaking in the country. And so that summary that we saw before from the CDC really kind of did a good job of pointing that out. And the other nice thing is now they have it for flu A specifically. So as you can see, there's limited data, but at least what we can ascertain from here is that, maybe Washington State, Arizona, some parts of the Southeast, New York, are experiencing a little bit more like moderate activity with those reporting. So we're already starting to see flu is more or less the point to share here. And this is relative to wastewater monitoring. So keep in mind that the discrepancy here. This is not emergency department visits, which are typically more severe presentation. This is wastewater monitoring. So this is indicating somebody that may be experiencing, severe, mild, or very asymptomatic situations relative to flu in this case. So, but somebody is shedding the virus, so they're infected. So this is just kind of a good idea of like what we're seeing right now in terms of, flu is circulating even right now because the season has started, right? It starts at the last week of August. And then along with that, they have RSV, fortunately still at kind of like minimal or baseline activity, but it is something just to keep an eye on in terms of that activity. So, just kind of wanted to mention that, this is kind of neat, and this is kind of great from the CDC to kind of have this broken down in that manner. So anyways, with that said, just a quick recap, in terms of prevention, the core prevention strategies, immunizations, hygiene, steps for cleaner air, and, getting that fresh air in, filtering air, the treatment with Paxlovid, stay home and prevent spread. And then along with that, the additional prevention strategies like masks, the distancing and testing, especially with the rapid test. And also, everybody will be able to order those things, later this month. That's the COVID.gov website. So that's going to be great once that's available. So just stocking up on those as we kind of progress further into the season. But again, just staying home until symptoms are better. And until, without using any sort of fever reducing medications for 24 hours, then taking the 5 days of precautions as kind of outlined here. So, you guys heard this a million times, so I don't want to keep beating a dead horse, but just as a reminder, because we're still trying to get through this current COVID activity, and then let alone, we're going to have that uptick and the real pickup, the part of November, especially with Thanksgiving and all the other holidays. So, with that said, switching gears, going to mosquitoes, this is for West Nile virus activity. Again, the point to hit home here is we have very substantial West Nile virus activity, especially where we're at in Lower Fairfield County and Fairfield County in general. And again, just keep in mind, this is where we're at in Norwalk. So we're really in the hotbed of activity. And, we emphasized this point before, but this is a very unique season in terms of just presenting so early and then at such a high level in terms of this activity and the positives that are presenting. So then let alone kind of the Hartford area's experience as well, along with the southeastern portion of the state too. And so just keep in mind now, because, the state usually just does a press release relative to the first human case. We've had 3 so far, 1 in Fairfield County, 2 in New Haven County. And then also looking at Triple E, which is, even greater concern, especially in terms of its case fatality risk. And again, typically as we see, it presents in the eastern part of the state, and it's very substantially presenting here, right? Certain towns are experiencing, 26 or 15 mosquitoes testing positive. But then it's also made its way further west, to the central part of the state. So even as far as Farmington with 5 positive mosquitoes. And then keep in mind that, there's been a veterinary case relative to a horse in Fairfield County. So it has even made it to Fairfield County relative to an animal. So it's just something to kind of keep in mind, keep an eye on. Because, again, this is a very unique season with, Triple E even getting this much territory and presenting at these numbers too. Let alone we have to wait till the real first frost to kind of balance that out and reduce that mosquito activity. And, we're not there yet. We still are in September. And so it's just something that we're in for the long haul, as we're kind of, very, very much aware. And so now switching gears, we're just going to go to Mpox really quickly. CDC just released the Health Alert Network message yesterday. So talk about timing. And so this is actually reemphasizing in the aftermath of another CDC HON they did in August. And again, that's about Mpox, and especially the big concern with Clade 1, which has been making its way, slowly, but, around the globe too, right? It's not just centralized to, Central and Eastern Africa, but this messaging here right now is just making sure anybody traveling there practices, the common sense prevention measures just not to put themselves at risk, given the high level of activity and the high concerns about further transmission, and then somebody goes back to their home country and then transmits it there. Then along with that, especially the biggest thing is the vaccination for Mpox, which is a 2-dose series, making sure that individuals that anticipate traveling to Eastern and Central Africa, are up to date with that and have done that before traveling there. And then again, practice those common sense measures not to transmit and run the risk of acquiring the virus that way too. So again, the focus is sexual contact and exposure. So I just want to emphasize that because that's right there in the title from the CDC. Again, this Health Alert Network message is for healthcare providers, but still, I think this is very important for all of us to be mindful of as we want to contain this and not continue to have global spread of especially the clade 1, but let alone clade 2 of Mpox. And so with that said, just as a reminder, we have been dealing with clade 2 as we're familiar with since 2022. And so this is looking at New York City data for Mpox. And as you can see here with these blue lines that just indicate the number of diagnosed cases, still we're dealing with substantial activity relative to Mpox, even in New York City, which is a great kind of picture of what's going on. New York City is going to obviously be a hotbed of that, given the density of individuals and things of that nature. And it's a good indicator for us, given our proximity, as we're kind of familiar with. I just want to emphasize that point. We're still dealing with clade 2. We don't want to deal with clade 1. There's the potential clade 1 could be out there too, right? Somebody has to be tested for it to be detected and determined that it's clade 1. So it's just really important because, again, clade 1's very concerning with, again, its case fatality and sequelae risk or long-term effects that it do. So just want to emphasize that. Then along with that, the CDC has updated their finder for Mpox vaccines. I did want to caution that it's not too great because it does simplify it, but as you can see, like say if we put like a Norwalk zip code here and I was just testing it out, it just says there's 0 locations. And when you zoom in, you don't quite see anything. So this is brand new. So I suspect they're going to be fixing this. So in the meantime, what I recommend going to is the DPH webpage, and they have the breakdown of providers. And we have a provider here in Norwalk, Circle Care Center, that does provide the Mpox vaccine. So this is where I recommend people get information in the meantime until that's resolved relative to the CDC website. So, again, there's criteria again who would be best apt to get this vaccine. And again, keep in mind it's a 2-dose series. And so again, that's any sort of men who have sex with men, anybody that might be having kind of high risk sexual activity where they could run the risk of exposure, things of that nature where somebody might suspect they might be exposed to somebody that has Mpox relative to that close contact, sexual contact. So it's just really important, and again, not an easy thing for us to kind of communicate to the general public, but it's important because we want to contain this and definitely not deal with clade 1 in the United States. And so it's just, a really important thing that we want to contend with. And again, why the CDC, even a month after just doing another CDC HON, released this one and made the point of doing this too. And so I just want to kind of emphasize that. So in summary, again, we're dealing with our respiratory virus season having started. COVID activity still unfortunately high in the United States and Connecticut, but we are starting to see flu activity even in the United States. So that should be something that's kind of waking us up. And again, with the vaccines that are readily available now to get them, I think that's really important, following the prevention measures that are, that we're all kind of very familiar with. Keep in mind that we still have to deal with the mosquitoes. There's a lot of mosquito activity, so just be mindful of that until we get to the first frost. And taking those prevention measures to protect oneself, as well as mitigate the opportunities for mosquitoes to set up new residences, so to speak. So reducing where water's, standing water kind of collects. And then along with that, keep in mind about Mpox and, just the prevention measures associated with this, because we want to keep this contained and not deal with clade 1 in the United States. So that's the summary for everything. All right, thanks everybody.
Thank you, Brian. Does anybody have any questions?
No, not for me.
Thanks. All right, I'm going to give a couple of quick updates. We have our flu clinics that are going to be starting in October on Thursdays. And if you go to norwalkt.gov/flu, you'll be able to see information and details about our community flu clinics. And we're going to begin publicizing those to the public. And I did want to recognize and honor Terry Quell today during our board meeting. She has to step down. She doesn't have the time right now to commit. And so I just wanted to acknowledge her and thank her for all her years of service to the Board of Health. I'm hoping she'll in the future be able to come back. But she's been a real incredible leader at the health department and on this board. She's connected us to different public health nursing students to work on projects with us. She is our policy and procedure guru. She looked at all our different policies and procedures and provided such important edits and feedback to us and has really helped us and made us better with all our different policies. She's been a huge advocate for health and the community. She's been a huge advocate for the health department and our staff. She's helped us figure out, as we implement different ordinances, as we communicate really critical information to the public related, to restaurant inspections and other different topics. And so I'm going to miss her, and I'm hoping she'll be back. But I just wanted to acknowledge Terry Quell and thank her for her amazing years of service. And she'll be helping in the background too if we ever need her. So wanted to thank her and acknowledge how amazing she is. Does anybody have anything else before we wrap up? All right. Thank you, everyone. Thank you for all the great presentations, and thank you for all your great feedback, board members. Have a great day. See you
Thanks.
next
You
month.
too.
Bye-bye.
Bye.